Hope you're having a great day. It's Friday and I'm on my way home from work. I had a good day today. I got to take care of some amazing women. What's been kind of in my head this week with a lot of women that I've taken care of are fibroids. Sure, to what extent your knowledge of fibroids are, but fibroids are benign growths on or in the uterus that are not cancerous, but they can make women pretty miserable. They can affect the periods, causing heavy menstrual bleeding. They can cause painful periods. They can cause severe anemia depending on how heavy the periods are. Bloating. They can cause bowel issues, so constipation, depending on the size of them and location of them. Bladder issues, urine leakage, again, depending on the size and location of them. And they're very prominent, and a lot of the women I take care of have been brushed off for years. For appropriate interventions to deal with fibroids. Management of fibroids can come in many different forms or fashion depending on the woman's age, reproductive status. Is she planning on having any more babies? Has she even begun to have babies? And so usually what I talk about with patients with their fibroids are the size, the quantity that we can see, and their options. First option, do nothing. If they happen to be an incidental finding, then we don't necessarily have to do anything. And it depends on if she's trying to get pregnant. Then there's medical management, so that's going to be your birth control methods, IUDs, to manage the symptoms or manage the heavy menstrual bleeding or the cramping. Then there's medication that's made specifically for women with fibroids to address the heavy menstrual bleeding. And then the next option is surgical management. So the surgical management is going to be a myomectomy, and that is a procedure where you have the fibroids surgically removed from the uterine muscle. The thing with myomectomy, depending on the size of the fibroid, the location of the fibroid, can cause you to have C-sections for any future pregnancies. Then there's a procedure called the UFE, a uterine fibroid embolization, and that's where a radiologist would go in, block off the blood vessels to the uterus that supply blood to the fibroids, and can shrink or completely get rid of fibroids, alleviating the heavy menstrual bleeding or the pain associated with the fibroids. And the only way to completely cure fibroids is to have a hysterectomy. And a lot of women just aren't there. Like, no one wants to have major surgery. Bleeding and pain for long enough, and that's going to give them a cure and a definitive, you're not going to have any more fibroids, then that's an option that is very plausible and is a very good option for some women. It just depends on where you're at in your journey. It depends on where you're at in your life, where you're at in your family and your childbearing. All those things have to be taken into consideration. But women have to be educated about what is normal and what is not normal with their bodies, and given all the information so that they can make an educated decision for what works for them and their families. It is not my job to make that decision because I don't know everything that she's got going on at home, nor can I make assumptions. Women that are watching this, don't just assume that because you have a heavy, painful period, or you're having abdominal bloating or constipation issues that have just progressively gotten worse over the years, or bladder leakage, that is all just a normal part of aging or a normal part of your body. Those things aren't always normal. Speak up. And my hope is that you guys have great providers taking care of you that are willing to go the extra mile that you deserve. I hope that was helpful information. And if you have any questions, or if I need to explain anything in any more detail, just leave me a comment. Go ahead and like and subscribe below. I hope you guys have a great weekend. Happy Easter. And I pray that you all are safe and healthy and well. Love you guys.